ਵੈਲਕਮ ਟੂ ਦਿਸ ਐਪੀਸੋਡ ਆਫ ਦਾ ਹਰਪ੍ਰੀਤ ਸਿੰਘ ਸ਼ੋ। ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਫਾਰਮਾਸਿਸਟ ਐਲਨ ਗਲੈਸਨ ਨਾਲ ਗੱਲਬਾਤ ਕਰਾਂਗੇ ਤੇ ਸਾਨੂੰ ਦੱਸਣਗੇ ਕਿ ਜਦੋਂ ਪੇਨ ਹੁੰਦੀ ਹੈ, ਦਰਦਾਂ ਜਿਹੜੀਆਂ ਹੁੰਦੀਆਂ ਨੇ, ਉਹਨਾਂ ਨੂੰ ਕੰਟਰੋਲ ਕਰਨ ਵਾਸਤੇ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਇਸਤੇਮਾਲ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ। ਅੱਜ ਜਿਸ ਵਿਸ਼ੇ 'ਤੇ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਹਾਂ ਜੀ, ਇਸ ਦੀ ਬੜੀ ਮਹੱਤਤਾ ਹੈ ਕਿਉਂਕਿ ਅੱਜ ਅਸੀਂ ਦੇਖ ਰਹੇ ਹਾਂ ਕਿ ਕਿਸੇ ਨੂੰ ਗੋਡਿਆਂ ਦੀ, ਜੋੜਿਆਂ ਦੀ ਦਰਦਾਂ ਨੇ, ਕਿਸੇ ਨੂੰ ਕੋਈ ਦਰਦ ਹੈ, ਪਿੱਠ ਦੀ ਦਰਦ ਹੈ ਜਾਂ ਸਿਰ ਦਰਦ ਕਿਸੇ ਦਾ ਰਹਿੰਦਾ ਹੈ। ਸੋ ਇਹ ਦਰਦਾਂ ਦਾ ਕਾਰਨ ਕੀ ਹੈ, ਇਸ ਦੇ ਪਿੱਛੇ ਕੀ ਰਾਜ਼ ਹੈ ਤੇ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਇਸ ਨੂੰ ਕੰਟਰੋਲ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ, ਇਸ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਾਂਗੇ ਐਲਨ ਗਲੈਸਨ ਨਾਲ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you very much, Harpreet.
Thank you. So when we talk about pain, there are various reasons for pain, and you had talked a little bit about in one of the segments. So if you could elaborate as to basically short-term pain, long-term pain, acute pain, chronic pain, there are so many pains. What is it?
Yeah, that's a very good question, Harpreet. So one of the things about long-term chronic pain, there are actually, interestingly, two different pathways. You know, one pathway is you bang your hand and you can feel it instantly. You know exactly the spot that hurts.
Right.
When you sometimes are in long-term chronic pain, all of a sudden the area expands from that tiny little area to maybe like the whole wrist, the whole arm can hurt you.
Right.
And that actually is a different pathway. And what happens is our drugs are very effective at the acute stage where bang, you just hurt yourself and it's very localized. And it's difficult when it becomes generalized over a large area.
Right.
And that can happen in your back, on your arm, on your leg. You have generalized pain all over.
Right.
And that's extremely uncomfortable. Patients or clients end up taking massive amounts of over-the-counter drugs, or they're taking prescription drugs, or even prescription narcotics to control the pain. And that the issue in people's lives become side effects.
Right.
Because all those drugs, the aspirins of the world, the Aleve of the world, the Proxen, Celebrexes, they may irritate your stomach. They can raise your blood pressure in 25% of the cases. And people just don't like taking pills.
Right.
It's interesting, if you do have long-term chronic pain, I will give you a secret that if you go on DM, okay, so there's a cough mixture. It's called, Benylin DM, Robitussin DM. The DM actually blocks the pain sensation from that diffuse, wide open chronic pain. I have had many of my patients. They just take, it says for cough, but you can take the same dose and get pain relief.
Okay.
Okay? Normally it's about 600 milligrams 4 times a day. So when you read the box label, I'm sure you can find it any pharmacy, a DM cough syrup, just the DM.
Right.
And they used to, in America, in the US, they have actually in capsules. In Canada, most of the time it's just in liquid form.
Right.
And takes the 600 milligram dose. You can take about every 6 hours. That can be a huge help for you if you're in pain and long-term chronic pain. That's, again, the very diffuse pain. You can't really pinpoint it. It's all over this area. Many people get a great response by taking the DM products.
Okay.
Number one.
Right.
Number two, long-term chronic pain. The only way that you and I feel pain, you got to remember, is an electrical nerve goes to our brain and says it's pain here.
Right.
So there's an electrical nerve sensation that's going all the way to our brain. If we can block that, you will not feel pain. Okay, and that's really important. This is a device. It's called a TENS machine, which means transcutaneous electrical nerve stimulation. Big long word.
Right.
Okay. It has, basically, it's that little gadget. It sends out certain frequency of electrical pulses. On the back, you'll see patches.
Yeah, these are the ones.
Right? We see these round patches. They go stick. So say if you had pain in your wrist or all on your arm.
Right.
You could put a couple of patches here and a couple of patches on the other side.
Right.
One on each side. You turn it on and leave it on. You adjust it, and amazingly, we're blocking the nerve transmission of pain to the brain so you feel less pain. That can happen very, very quickly.
Right.
The biggest issue is people with chronic back pain or lower body pain.
Right.
You actually put a couple of patches just below the neck, a couple of patches around the waistline, and you totally block the nerve transmission then of pain messages from your lower body to your brain.
But Alan, isn't it a temporary relief?
It is temporary, but there's nothing stopping you
Okay.
from doing that. I mean, here's what I see. The kind of client who'd use this, they have long-term chronic pain. The doctor says, we can't help you.
Right.
Maybe you need a knee replacement. You know, maybe you had an injury. They can't figure out why you have pain.
Right.
And you just want it to stop.
Right.
Most of my clients or patients who walk into Mark's Pharmacy, 80th and Scott Road, that is an issue in their lives. They cannot get relief. They're not happy with the prescription or non-prescription drug regime they're taking. They want an alternative. Well, there is an effective,
a drug-free alternative.
a drug-free alternative. Actually, in Mark's Pharmacy at 80th and Scott Road, what I have is a rental unit. You can come in and for $25 a week, we'll give you the rental unit to try it out before you spend $100 or $200 or whatever you want to spend on this portable machine. So it's a TINS machine, and it's just electrical stimulation, very safe, and can be very effective, and you can try it before you buy it.
You talked about the drugs, the side effects of drugs, and as we are seeing progressing that today, people are facing lots of challenges, lots of issues, and that's because the drugs what they're taking, they're not realizing the impacts what it is having on their body. You being a pharmacist for a long period, what are you observing over the years? What are the trends which are coming forward, and the emergence of alternative medicines, alternative means of against drugs? Is it helping the people?
That's right. So what I'm really seeing, because of the increase of disease in our population, as we age, people don't exercise enough. They sit there and we eat too much just because it's so easy. And then we get these chronic long-term diseases. One is diabetes.
Okay.
Number 2 is high blood pressure.
Right.
Number 3 is heart disease. Okay, so cardiovascular disease.
Right.
And I would say 80% of my seniors, people 65 and over, what is the greatest number of prescription drugs if you need medication? It's these 3 things. And I will tell you that, in my opinion and some other physicians' opinion, we can control this by getting off the couch and exercising, doing this away from the table, right? This is the best exercise you ever had, pushing away from the table.
Right.
So you reduce the amount you eat, and that's going to affect your diabetes, your high blood pressure, and your heart disease. Because if we can change the amount of calories you get in and the kind of calories, again, eating raw fruits and vegetables rather than cooked and fried foods is so much better for you. It's just unbelievable the difference it can make in your life. Again, because really and truly, the pill doesn't solve your problem.
Right.
Unfortunately, I have many of my patients who think, oh, if I take this pill, I can still eat the donut. I still go to Tim Hortons and eat all the donuts I want. No, you can't. Diabetes means your body can no longer. That's right. So if you're on these drugs and that is your problem, this is what can happen. Now, the most common adverse effect actually is reduction of an enzyme that's in every cell of our body. It's in the energy production cell of our body. So typically what happens to patients who have diabetes, who got high blood pressure, cardiovascular disease, they go on the medication. So what the question becomes, why am I barely able to crawl up the stairs? Why am I barely able to get out of bed in the morning? I have no energy. I'm totally fatigued, tired. It's because of a lack of a crucial enzyme that our medication depletes. It's called a drug nutrient problem. And the nutrient missing, because there's a cycle, a chemical engine, a little chemical, I call it a steam engine inside every cell of your body. It's called a mitochondria, just for a name. That little steam engine is going like crazy. It's got, think of a flywheel. It's got a little firebox. It's chemical, but just to imagine it.
Right.
And what you do when you take some of your medication, it's like pouring water on the firebox of your steam engine. What happens? Just the wheel doesn't turn anymore, or it slows way down. So what happens to the cell? It doesn't work very well.
So
you
how
feel
to
tired.
get back to that energy, because that's again a crisis what we are finding today in this fast-paced life. Let's go for a small break, come back, and we'll talk about this as to how you can have that kind of energy when you are up in the morning and you are working around. We'll talk about this. ਸੋ ਜੋ ਹੁਣ ਤੱਕ ਐਲਨ ਨਾਲ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ, ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਪੇਨ ਨੂੰ ਕੰਟਰੋਲ ਕਰਨ ਵਾਸਤੇ ਅੱਜ ਬਹੁਤ ਸਾਰੀਆਂ ਚੀਜ਼ਾਂ ਨੇ। ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਕਿ ਇੱਕ ਟੈਂਸ ਨਾਂ ਦੀ ਇੱਕ ਕੁਝ ਹੈਗੇ ਨੇ ਪੈਚਸ ਜਿਹੜੇ ਕਿ ਤੁਸੀਂ ਆਪਣੇ ਸਰੀਰ ਤੇ ਲਾ ਸਕਦੇ ਹੋ, ਇਲੈਕਟ੍ਰੀਕਲ ਇੰਪਲਸਸ ਤੁਹਾਡੇ ਬਾਡੀ ਦੇ ਵਿੱਚ ਜਾਂਦੀਆਂ ਨੇ ਜਿਸ ਨਾਲ ਕਿ ਪੇਨ ਕੰਟਰੋਲ ਹੁੰਦੀ ਹੈ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਪੇਨ ਦਾ ਮੁੱਖ ਕਾਰਨ ਇਹੀ ਹੈ ਐਕਿਊਟ ਜਾਂ ਕ੍ਰੋਨਿਕ, ਕਿ ਤੁਹਾਡਾ ਲਾਈਫ ਸਟਾਈਲ ਵਿੱਚ ਚੇਂਜ ਆ ਗਿਆ, ਐਕਸਰਸਾਈਜ਼ ਘੱਟ ਹੋ ਰਹੀ ਹੈਗੀ ਹੈ, ਇਸ ਦੇ ਨਾਲ ਬਿਮਾਰੀਆਂ ਵਧ ਰਹੀਆਂ ਹੈਗੀਆਂ ਨੇ। ਅਤੇ ਜਿਹੜੇ ਅਸੀਂ ਡਰੱਗਸ ਖਾਂਦੇ ਹਾਂ, ਜਿਹੜੀਆਂ ਅਸੀਂ ਦਵਾਈਆਂ ਖਾਂਦੇ ਹਾਂ, ਅਸੀਂ ਸਮਝਦੇ ਹਾਂ ਉਸ ਨਾਲ ਜਿਹੜੇ ਸਾਈਡ ਇਫੈਕਟਸ ਨੇ ਉਹ ਅਸੀਂ ਭੁੱਲ ਜਾਂਦੇ ਹਾਂ। ਤੇ ਉਸ ਵਾਸਤੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਉਹ ਸਾਈਡ ਇਫੈਕਟਸ ਨੂੰ ਵੀ ਮੀਟ ਕਰਨ ਵਾਸਤੇ ਆਪਣੇ ਲਾਈਫ ਸਟਾਈਲ ਵਿੱਚ ਚੇਂਜ, ਸਾਡੇ ਖਾਣ ਪੀਣ ਦੇ ਵਿੱਚ ਜਦੋਂ ਚੇਂਜ ਹੋਏਗਾ ਤਾਂ ਉਸ ਨਾਲ ਆਟੋਮੈਟਿਕਲੀ ਜਿਹੜਾ ਡੈਫੀਨਿਟਲੀ ਬੈਨੀਫਿਟ ਹੋਏਗਾ। ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਜਿਹੜੀ ਗੱਲ ਕੀਤੀ ਕਿ ਐਨਰਜੀ ਲੈਵਲ ਕਈ ਵਾਰੀ ਬਹੁਤ ਲੋ ਹੋ ਜਾਂਦਾ ਹੈ, ਉਸ ਨੂੰ ਬਿਹਤਰ ਕਰਨ ਵਾਸਤੇ ਕੀ ਕਰਨ ਦੀ ਲੋੜ ਹੈ, ਇਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਂਦੇ ਹਾਂ ਇਸ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ। ਵਨਸ ਅਗੇਨ ਵੈਲਕਮ ਬੈਕ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ। ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਵਾ ਰਹੇ ਹਾਂ ਮਿਸਟਰ ਐਲਨ ਗਲੈਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ ਤੇ ਸਾਨੂੰ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਅਸੀਂ ਆਪਣੀ ਐਨਰਜੀ ਲੈਵਲ ਨੂੰ ਬਿਹਤਰ ਰੱਖ ਸਕਦੇ ਹਾਂ, ਸਾਰਾ ਦਿਨ ਕੀ ਕਰਨ ਦੀ ਲੋੜ ਹੈ, ਇਸ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ। So you were talking about the energy level which gets depleted even in the morning also when you are woken up, and that's the time when you say you are the best, you had a good night's sleep and you have got up but still you are yawning and feeling as if it's not, you need more sleep. So why does that happen? You were giving the example of a mitochondria, and when you put water the fire gets depleted kind of thing. So basically what's happening, and what can it be helped? Can the people be helped on this?
Well, that's the beauty of it. Yes, the people can be helped. Now,
Okay.
no one is supposed to stop their medicine.
Right.
I'm going to go through a list of the kinds of prescription drugs and actually non-prescription drugs that can cause this problem.
Okay.
So we thought number one reason that patients who are on high blood pressure medications such as digoxin, the kind of nutrients that are depleted are calcium and magnesium.
Okay.
So you've got to make sure that you take enough, that you're taking a supplement. So important to get a vitamin supplement on a regular basis.
Okay.
We'll talk about better kinds at once. And of course, if you're lacking calcium in your diet, that leads to thinning of the bones. That's called osteoporosis. It leads to cardiac arrhythmias. I mean, your heart rhythm, even though you got a heart problem, your rhythm can go out of sorts. Lack of calcium in your diet leads to muscle cramps and tooth decay and even sleep disturbance.
Okay.
Number two, cardiovascular medicine, they're called a class of drug called beta blockers. Now, that's something ending in like metoprolol. You'll see it on the label on your prescription drugs.
Okay.
Bisoprolol, atenolol. And there's anything that ends with that OL, that's called a beta blocker.
Okay.
And what beta blockers do is they deplete or stop the body from absorbing a very important enzyme, the Q10. Okay. This is the one that powers our chemical steam engine.
Okay.
The enzyme is called CoQ10. Now, the problem with it and the kind of side effects you're going to feel is, one, you will feel fatigue, including symptoms of asthma and allergies. So this feeling of fatigue can make your allergies worse. Feeling of fatigue can make your asthma worse. And including respiratory disorders, including gum disease. Okay. And cardiac dysfunction. That means your heart won't beat properly. Again, think of it. It's the steam engine of your body.
Right.
And you're depleting it. So all the muscles, they won't work right. As a matter of fact, in one of the other drugs, that's another side effect. So the problem there is you got to fix it. You need to supplement with something called, if you're over 40, you can't just take CoQ10.
Okay.
You have to take an energized portion. It's called ubiquinol. The one that you can take under 40 is called ubiquinone, and it's without an electron. And the ubiquinone has an extra electron in it. So it's ready to give up its electron to get that steam engine really working hard. It's a chemical steam engine.
Okay.
So it's like pouring gasoline on the fire, so every single cell in the body works better.
Okay.
Okay, so that is what taking this particular form, ubiquinol, is a form of enzyme CoQ10, and that is the best form of it to take to give you the most energy. Another drug that depletes enzyme Q10 and folic acid, so is diuretics.
Okay.
So that's hydrochlorothiazide.
Right.
You see that name on your drug? That's the most common one. It depletes this enzyme Q10, so that's really important. What's the other one? Biggest one is cholesterol medication. Now, cholesterol medication, which many tens of thousands of people are on to help prevent heart disease, etc. Really, if the average, I was just looking at the stats, in over 10 years, 1 out of 38 people it may help prevent a heart attack in 10 years. But we have literally millions of people on it.
Right.
So, but the benefit defined is 1 person out of 38 over 10 years. It may prevent a heart attack. That's what we're looking at. But this cholesterol drugs, which it's got a statin in the last part of the name, is rosuvastatin, atorvastatin, and simvastatin. Anyways, so lovastatin, all these statin drugs, if you see a statin, they are depleting this, and specifically, I've seen maybe as high as 10% of patients on that feel muscle pain. Again, think of it, the steam engine doesn't run. If it's not running, things don't work right, especially in your muscles. The big long name of it is called rhabdomyolysis, but your muscles cramp up.
Right.
So if you experience a lot of muscle cramping and you're on the cholesterol drug, you're on the hydrochlorothiazide, you're on the beta blocker.
Right.
Well, and then someone can well be on all 3 of those drugs very easily because they've got these problems, and your muscles hurt. It's not because you work too hard. It's probably because the drugs interfere with absorption of the Q10 or its manufacture. You need to take it externally, and you might have to take a fairly high dose.
Okay.
It's interesting that in Japan, this particular drug, it's on prescription.
Okay.
It's not. They class it as a drug. We class it as a supplement in North America, but it is on prescription in Japan.
Right.
Finally, the diabetic medicines. Okay, that's the metformins or the glycerides, the glucosides. They also deplete this enzyme, the Q10. So it's so important that you get on it if you're on any of these class of drugs. So we're talking about people, again, who have heart disease, and they're probably on one of these medications that cause this to be depleted, the Q10. Diabetics and their medication, which cause the enzyme CoQ10 to be depleted and then feeling all these symptoms. And finally, people with blood pressure medications. Again, they're affected. And finally, the big surprising one to me was people who are on antidepressants.
Okay.
Antidepressant drugs deplete enzyme Q10. So here you are, you feel happy,
Right.
But you wake up in the morning and you're still dragging your fanny because you feel tired. It can easily be that the drug is elevating your mood. That's what it's supposed to do, elevate your mood, but your energy level is low because it also, all class of antidepressants deplete this enzyme CoQ10.
Thank you very much for all this information. Thank you. ਸੋ ਐਲਨ ਨੇ ਜਿਹੜੀ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ ਦੀ ਬੜੀ ਮਹੱਤਤਾ ਹੈ ਜੀ। ਜਿਹੜੇ ਅਸੀਂ ਡਰੱਗਸ ਲੈ ਰਹੇ ਹਾਂ, ਜਿਹੜੀਆਂ ਦਵਾਈਆਂ ਖਾ ਰਹੇ ਹਾਂ, ਉਹਦੇ ਕਾਰਨ ਸਾਡੇ ਜਿਹੜੇ ਐਨਜ਼ਾਈਮਸ ਨੇ ਉਹ ਡਿਪਲੀਟ ਹੁੰਦੇ ਨੇ। ਅਤੇ ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਇੱਕ ਐਨਜ਼ਾਈਮ ਹੈ CQ10, ਜਿਹੜਾ ਕਿ ਸਾਡੇ ਸਰੀਰ ਦੇ ਵਿੱਚ ਜਿਹੜੇ ਐਨਜ਼ਾਈਮਸ ਨੇ, ਜਦੋਂ ਅਸੀਂ ਡਰੱਗਸ ਖਾਂਦੇ ਹਾਂ ਉਹ ਘਟ ਜਾਂਦਾ ਹੈ। ਸਾਡਾ ਐਨਰਜੀ ਲੈਵਲ ਜਿਹੜਾ ਉਹ ਬਹੁਤਾ ਉੱਚਾ ਨਹੀਂ ਰਹਿੰਦਾ ਹੈਗਾ। ਇਸ ਕਰਕੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਸਪਲੀਮੈਂਟਸ ਦੀ ਲੋੜ ਹੈਗੀ ਹੈ, ਜਿਸ ਵਿੱਚ ਕਿ ਇਹ ਐਕਸਟਰਾ ਐਨਜ਼ਾਈਮ ਲੈ ਕੇ ਤੁਸੀਂ ਆਪਣੇ ਐਨਰਜੀ ਲੈਵਲ ਨੂੰ ਬਰਕਰਾਰ ਰੱਖ ਸਕਦੇ ਹੋ।